In this video, I want to talk about our protocol when we are placing a zirconia implant. So we place a zirconia implant typically when we have a missing tooth or following an extraction of an infected tooth. So these are two sort of different processes. When we are dealing with an infected tooth, whether it's a root canal tooth that's infected or a tooth that is infected and has not had a root canal and patient wants to remove it, we remove the tooth after, of course, we do it with IV sedation. And the reason we do it with IV sedation is we want to make sure you're comfortable. The second reason we like IV sedation is that we have access to a vein and we do blood draw, and with the blood draw we do two different protocols. One is called advanced platelet rich fibrin, which we create a membrane, a fibrin membrane that has a lot of your white blood cells, growth factors, and about 1 to 2% of stem cells. And we use that in areas that we need to cover the site of extraction. Also, we do what's called injectable PRF, which has the same fragments of your blood, but it's in a liquid form. So let's say that we've done the extraction, and the first thing we do after the extraction is done, we use continuous ozone to kill all the microbes at the site of the extraction where there's an infection there. And the ozone is very potent antimicrobial. The other tools we use, we obviously curette it out, scoop out any fragments of the infection. We use piezo, which is an ultrasonic technology that loosens up all the dead tissue and infected bone tissue. And we use continuous irrigation with an isotonic saline. Typically we use lactate ringer for that. And all of that helps to eliminate the infection that has been present in the jawbone, which can have all kinds of health consequences. So cleaning up the infection is of utmost importance. And because we use all these different techniques and protocols, we want to make sure that there's no residue of infection left. Then at that point, if the patient chooses, if you choose to do an implant, then we can do a zirconia implant. Our favorite zirconia implant is Swiss Dental Solutions, called SDS for short. And it has different sizes that we pre-measure from the CT scan that we do it prior to the surgery. And we then prepare the area for the implant, the zirconia implant, the SDS Swiss Dental Solution implant. And once we've cleaned up the entire area with the ozone, with the PRF, with piezo, and all of that, then we place the appropriate size zirconia implant. And before we place it, we use the injectable PRF that has all the stem cells. And we place the appropriate size at the appropriate, what we call torque. We don't want to make it too high of a torque because that puts a lot of pressure on that bone, the healthy bone that's around the implant. And we don't want to make it too low of a torque because then it will not have a good anchorage. So that optimum torque is very important. Once the implant is placed in that optimum torque, in an area where we have injectable PRF and some of the harvested bone from your own jawbone in that area, the healthy jawbone bone structure, we mix it with the IPRF and we place it in that area. Once that is all done, we place a membrane of, we call it APRF, and cover all the surgical sites. So nothing is open to the elements of microbes in the mouth and so on. The APRF has fibrin and has your white blood cells, so it's a perfect barrier to protect the surgical site for healing. And the fibrin typically lasts 4 to 7 days. which is perfect for healing, because the first few days is the most critical time for healing, and that APRF is protecting the surgical site for that critical time of healing. And sometimes, especially in the front teeth area, if we have more than one implant, if we have, let's say, 2 or more adjacent to each other, we can actually put immediate provisionals, which is a huge advantage, and that we don't have to worry about not having teeth in that area. We can also do that for the back area as long as we have 2 or more with good torque and good foundational bone. If for whatever reason the foundational bone is weak, we don't want to load it up initially. We just want to give it time to integrate, and then we can go ahead into the restorative phase.